I want to start off by telling folks here how inspired that I've been by your continued resilience in the wake of the floods that devastated this region a few years back. And I remember traveling here right after they happened and how tough things were. I know I know the rebuilding. I know the rebuilding's been difficult, but you should know that you always have a committed partner in this administration to support the road to recovery. And we know that Iowa City is going to be as good as new and better. Cedar Rapids, all across the state, we're seeing that rebuilding take place. So it's just good to be back in Iowa. This is the state that first believed in our campaign. When all the pundits had written us off, when we were down in the polls, this is the state that inspired us to keep on going, even when the path was uncertain. And because of you, this is the place where change began. Because three years ago, I came here to this campus to make a promise. Just a few months into our campaign, I stood at the University of Iowa Hospital, right around the corner, and I promised that by the end of my first term in office, I would sign legislation to reform our health insurance system. On Tuesday, after a year of debate, a century of trying, after so many of you shared your stories and your heartaches and your hopes, that promise was finally fulfilled. And today, health insurance reform is the law of the land all across America. Yes, we did. Yes, we did. Just like the campaign that led us here, this historic change didn't start in Washington. It began in places like Iowa City, places just like this, with Americans just like you. It began when people had the courage to stand up in town hall meetings and talk about how insurance companies were denying their families coverage because of a pre-existing condition. It began when folks wrote letters about how premium hikes of 40 and 50 and 100% were forcing them to give up their insurance. It began when countless small business owners and families and doctors shared stories about a healthcare system that works better for the insurance industry than it does for the American people. So this is your victory, because when the special interests sent an army of lobbyists to Congress, they blanketed the airwaves with millions of dollars of negative ads. You mobilized, and you organized, and you refused to give up. And when the pundits were obsessing over who's up and who's down and how's this affecting the Obama administration and what's going on over in the House, and you never lost sight of what was right and what was wrong. You knew this was not about the fortunes of one party. This was about the future of our country. And today, because of what you did, that future looks stronger and more hopeful and brighter than it has in some time because of you. 3 years ago, we made a promise. That promise has been kept. Of course, over the last year, there's been a lot of misinformation spread about health care reform. There's been plenty of fear-mongering, plenty of overheated rhetoric. If you turn on the news, you'll see the same folks are still shouting about there's going to be an end of the world because this bill passed. I'm not exaggerating. The leaders of the Republican Party, they called the passage of this bill Armageddon. Armageddon. End of freedom as we know it. So after I signed the bill, I looked around to see if there were any asteroids falling or some cracks opening up in the earth. Turned out it was a nice day. Birds were chirping. Folks were strolling down the mall. People still have their doctors. From this day forward, all of the cynics, all the naysayers, they're going to have to confront the reality of what this reform is and what it isn't. They'll have to finally acknowledge this isn't a government takeover of our health care system. They'll see that if Americans like their doctor, they'll be keeping their doctor. You like your plan, you'll be keeping your plan. No one's taking that away from you. 3 months from now, 6 months from now, you're going to look around, you're going to be sitting in a doctor's office reading through the old People magazines. You'll say, hey, this is the same doctor. Same plan. It wasn't Armageddon. What this reform does is build on the system of private health insurance that we already have. So does that mean that it's going to solve every health care problem that we have? No. But it finally tells, oops, it looks like somebody may have fainted. That happens sometimes in the crowd. Just give them some space. If the medics can make sure to check on them, in the meantime, just make sure that they've got some air. All right? And if anybody has some water down there, that'd be great. They'll be all right. So, but here's what the bill does. It finally tells the insurance companies that in exchange for all the new customers they're about to get, they've got to start playing by a new set of rules that treats everybody honestly and treats everybody fairly. The days of the insurance industry running roughshod over the American people are over. So if you already have insurance, this reform will make it more secure and more affordable. If you can't afford insurance right now, or if you've been denied coverage, and I'll bet there's some folks here who don't have insurance or can't afford it or have been denied coverage, you're going to finally be able to get it. Costs will come down for families and businesses and the federal government, reducing our deficit by more than $1 trillion over the next 2 decades. That's what reform is going to do. Now, it's going to take about 4 years to implement this entire plan because we've got to do it responsibly. We need to do it right. So I just want to be clear. That means that health care costs won't go down overnight. Not all the changes are going to be in place. There's still going to be aspects of the health care system that are very frustrating over the next several years. But we have built into law all sorts of measures that in the years to come, health care inflation, which has been rising about 3 times as fast as people's wages, is finally going to start slowing down. We'll start reducing the waste in the system, from unnecessary tests to unwarranted insurance subsidies.